I started going to the doctor when I was a small kid. Doctors always told my mom that I was having growing pains, but she started taking me pretty early. My dad was still in the house. I was definitely younger than 6, but she did keep on taking me to different doctors, and they would tell her the same thing. Then as I got older, they started giving me pain med, and then I was in a car accident that probably didn't help things. But as I was like in my mid-20s, they were giving me like pain meds. I wasn't on anything like Oxy or anything like that, but it's a lot to be on muscle relaxers and pain meds every day and still have to function. I was a practice manager at a multi-million-dollar veterinary practice for 12 years or so, and trying to function every day and being on meds and still being in pain. That was, what a time to be alive.
Yeah.
I was diagnosed with fibromyalgia mid-20s, but like I said in the previous video, I think it's one of those things they tell you where they're not sure what's wrong, but they know something is not right. They give you that diagnosis because they don't know exactly what's causing you this pain or numbness or tingling or stabbing pain.
Yeah. And that is something that I see often, that this diagnosis of a condition that is not really all too well understood. Of course they understand, but then there's also always this like, we don't really understand why it kicks in now and why there are flare-ups and so on and so forth. So very often when our healthcare system is faced with that, there is just, quite frankly, a misdiagnosis or a misunderstanding of what brings pain. And we label these things, and then we go through life thinking we have that. We identify with this condition. And that is in itself very hurtful. So I encourage everyone who sees that, if you think in your mind, I have fibromyalgia, in my case it was ankylosing spondylitis, I have, what have you, rheumatoid arthritis. I'm not saying that it is not true. I am saying that it may not be true in the way that your physician understands it, or that you understand your physician. But let's go back to something that addresses the why. And I'm going to let you speak freely, because we discovered through a process that I work with that there's always a fundamental underlying root cause of why someone has the fragility that is leading to life happening to you and then a pain manifesting. And in your case, I'm going to let you speak for yourself, so I don't put words in your mouth, but in your case, it's something that I know for a fact is what a lot of people, a lot of women, a lot of men have been exposed to, but is not really talked about often enough.
I think just like the majority of Gen Xers, right? We have trauma, lots and lots of trauma. Sexual violence, being in unsafe circumstances as a little kid, finding out just a few years ago like fibromyalgia is caused by intense psychological trauma. And if I'm stressed, even if it's, I don't have stress at work now, but stress managing other people can be stressful, and stress in your relationship, family life, I would find myself in a lot of pain very soon after that stressful event.
And that is hugely misunderstood and underestimated. These painful things that happen to us, the abuse, the physical and mental stress, the fact of just having to go through professional stress, is very often, I'm not saying always, I'm saying very often, the root cause. This is like this buzzword that we like to use so much, but it is really the most fitting in this conversation. The root cause of why you experience this inexplicable pain. And something that I like to be transparent about is that the journey of health and being pain-free is not always a straight line. If you would explain, because we had to meet several times and we're going to also give you a session today, if you would explain how you experienced your first breakthrough with me, and then there was a second time and there will be a third time now.
I came in here by accident. I was just coming to be friendly, but Andrea told me to have a seat. You came in and started doing a treatment on me, and I think most people are naturally skeptics, right? Especially if you've been dealing with something for so long and someone's, I can help you with this. Yes, please help me. But I did notice a difference immediately, like during your treatment. And I did feel a lot lighter when I left, but it was the next day. And then the next day that I woke up that I started feeling really good.
Yeah.
And it lasted like a week. And then that last time that you helped me out, it's lasted a while. I even went on a road trip that was 20 hours of driving. And I can usually make it from here to Austin before I'm like writhing in pain from issues or sciatica things. I was able to drive there 20 hours back. Wow. 20 hours. Yeah. And I was still good. That's mind-blowing. But then got into some mental distress. Experiencing pain again, and it is that nervous system. Everything's affected by stress.
Okay, so I'm going to take a moment to explain what's going on here. So whenever we have chronic pain, I like to explain it like an onion with multiple layers. And what the body does is it's trying to prevent you from going somewhere it doesn't want you to be, and it happens to use the method of pain or emotional distress. In this case, let's stay with pain because you do happen to experience a lot of pain when your nervous system is rattled up. So what happens is you have these multiple layers that represent the protective mechanism that manifests in pain. And when we do the nervous system reset, we eliminate that layer. It is effectively eliminated forever. And sometimes what happens is we go through life, even after feeling better, after being quote unquote healed, for lack of better terminology here, and then someone forces you into a conversation that you didn't want to have, or it's not even forcing, it was inevitable, right? It's life, it's being human. We have the conversations, and then that creates a new trigger. And that's what's going on here. So it's important to understand, though, that the more often you go through this re-triggering and fixing your nervous system, it's a little bit like vaccinations, like your body will become more and more resistant to new triggers. So that's the good news. But what I really want to bring across is that if we cannot bubble wrap, you have to live. And I want to explain that in these complex situations, and fibromyalgia is definitely a complex one, there can be bumps in the road, let's call them like that. And that's why understanding this is so important, because it leads to you understanding I gotta protect myself as much as is reasonably possible.
Not me disassociating mid-conversation. I'm like, I wish I could disassociate while those thoughts are happening, not during the conversation.
Yeah. Listen, with what I said about the bubble wrapping you and that not being possible, do you have any thoughts around that? I'm sure you were like, I want to remain feeling good.
Absolutely. Sorry, Mom, I avoided you for a minute. I was trying to protect my peace, right? Just trying to keep everything feeling good, because it is mind-blowing that I'm just like, I am sitting here. This must be what everybody else feels like. They're able to just sit here and be present and not be like, man, the middle of my back feels so awful right now. It's just, it is mind-blowing. Like that, just the treatment that you've done on me has been able to, it's like a cure. It is.
Everybody has their spots in the body that they use almost to gauge whether they're in pain or not. What are those spots for you?
Probably my SI joint, my cervical spine. I'm leaning at like a 45-degree angle most of the day when I'm working, so that it does take a toll on your body. You know, my legs would feel like hot, like when you slam your finger in a drawer by accident, like that type of, that throb. I love that.
Yeah. And by the way, for all of you watching, if you are curious about understanding more about this nervous system reset, I do have weekly webinars, so no matter where you are in the world, you can go to the link in the description of this video, or wherever you see it. It's most likely going to be on YouTube, but if it's somewhere else, the link is going to be somewhere, and you can sign up. And these are live Zoom sessions where I just explain what's going on. You can make up your mind whether you want to learn more, or maybe come to San Antonio. Some people fly me out. There is also, to a certain extent, I actually have a client in Australia who suffers from fibromyalgia, and I was able to help her remotely just by teaching her a few techniques. Like, not to the degree that we were able to help you, where it was like completely gone, but even 30-40% improvement is good, right?
Yeah, absolutely. Remember I had made the joke about the spatula? I couldn't remember where to tap, so I was like, bro, I got a spatula. She put my spatula in like the dishwasher. I was like, bro, this is my spatula. Like, for my mental health, okay? Like hitting myself with it.
Your mental health spatula. I can't know for sure when I'm done with it, but I have this idea of a self-serve course where, you know, people can, for who don't have the finances or who live somewhere where it's just completely out of question to see me, where they just can go through it and help themselves. Again, not maybe the same, but really make huge progress. So to be entirely transparent, that people, because we're about to do a live demo, it just so happens that you had a little bit of, how do you want to call it, mental stress, or
mental distress.
Mental distress recently, and you had a setback, so you were feeling great, and now what's hurting at present?
Like, I'm waking up and I'm like, oh my god, everything hurts, but everything's hurting right
Everything's
now.
hurting, So this is actually very good, because it shows you can be hurting and then being good, then you can be hurting again when, you know, there's a different conversation. And how long have you been good before this most recent setback?
The last treatment I had with you, it was definitely before that trip.
So maybe 2 weeks.
Couple weeks,
I think the first time was 1 week, and then 2 weeks, and now hopefully it's either 3 weeks or a lot more. Like, I can definitely tell you there is, at some point, the nervous system is so robust that it says, okay, now I'm good. I won't fall back into my protective mechanism anymore. We often used your shoulder as an indicator to see what's our progress, right? So what is, first of all, is lifting your arm even possible now?
It had been, but like right here already.
Right now, that's where it hurts.
Like, I can feel the pinching.
Yeah.
I tore my rotator cuff. I have frozen shoulder, right? Perimenopausal, love that. And then I fell down the stairs, so tore that. And I was telling him I'm left I drive with my left hand, so I want to put my elbow back up on the windowsill. Can't do that, and he has fixed that for me.
Okay. So we'll see. I'm going to attempt to fix that again.
No pressure.
And then, yeah, no pressure on video. But I will say, well, let's first try. Even if it did not work now, then it's these things with the nervous system are very dynamic, because it depends sometimes also on the recency and like when, or if I should say, if there is an acute justified reason for pain, the body will not let go of the pain because it's literally there to protect you and save you. But yeah, we'll find out, and yeah, that's what we're going to do now. So what I'm gonna start with is I'm going to balance her nervous system in a way where these protective mechanisms that manifest in pain go down. And I'm going to do that using a very large number of stimuli and of principles that I have brought together from a large set of healing arts. Some of it comes from traditional Chinese medicine, some of it comes from acupressure, kinesiology, applied kinesiology, a little bit out of Western medicine as well, EMDR. So there's a lot of things that come together to make this happen. So, and I will ask her several times, check, is it better now? So let's get started. With what I've done so far, a lot of people start feeling the first little bit of improvement. And as I told you, we're going to use the arm as an indicator. So, Monique, would you lift your arm and see if you feel a little bit of a difference? It's a little higher, but it's definitely still, you have that in that pain, right? When you come to this level. Push up. Okay. All right, open your eyes and follow my 2 fingers. Alright, lift the arm.
Okay.
So any better? A little bit?
Yes.
Okay. So we're experiencing live on camera that shift that I was talking about. And I know, because this is not the first time that I work with Monique, I know that her body is capable of completely letting this go. So that is our goal. I'm gonna try some more. Push. 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 Okay. If you're wondering, by the way, what is this pushing all about? It is something that I borrow from kinesiology. It's called a muscle test, and it basically gives me a way to speak to her nervous system. What I'm doing here comes from traditional Chinese medicine. We have energy meridians going through our body, and just going up and down the meridian can help unblock that energy. So you see, what I do is really a mix of the Western approach, where you have these very clear-cut scientific indicators like muscle tests, but there's also an element of something that is not so tangible, which is just moving up and down someone. And yeah, also this here is part of an energy meridian that starts here, and then I clear it. They call it clearing the meridian. Yeah. Push up. Okay. Push up. Push. Push. So you're wondering, why is he tapping and clapping next to her parietal here? Is because this is where I speak with the nervous system, and it doesn't speak our human language. It uses stimuli, right? This input. So in this case, I discovered that push is good now, but before this reset, whenever my hand was here, there was a little bit of hesitation in the muscle test, and that shows me that there's a protective mechanism around this area. And you can lower the arms. And even if this is here, that can impact the left shoulder, because everything in your body is connected. This can impact your neck, your lower back, your knees. Everything is connected in the body. So I'm going to do something now, which comes from a gentleman whose name is Moshe Feldenkrais. And he discovered that the brain permanently creates these maps of what in the body exists and what is fine and what is not fine. And sometimes it links something like this part of your head to your shoulder. So by me tapping that slightly, I allow it to build a new, healthier relationship, if you will. So if you would lift your arm now and see how that feels for you.
It's helped.
It's helped.
It has helped.
It has helped. And again, I know we can do more, so we're going to continue our treatment. Push. 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 Now, I use these tuning forks to also help reset the body. Now, when people see me on social media, they think, oh, it's the magic tuning fork, it's the tuning fork method. No, it's really just a tool, and what it does is it brings vibration to the body, in the skull, in the bones, and that helps me with a principle called multi-stimulation overload, which comes out of neuroplasticity neurology. In layman's terms, we overwhelm the brain so that it forgets its protective mechanisms around that area. Push. 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 Okay. Push. Push. Next. Lift arm. The same, no improvement this round.
No, I do feel. No, I feel an improvement.
Okay. Oh yeah, yeah.
Yes.
Wow! Would you look at that?
I know it's gonna be like even easier.
Yeah. Woo! I don't follow a procedure. I only listen to what the body tells me And that is really the power of this method, where I don't even, to be quite frank with you, I don't even need to know what is the problem, neither does she need to know. It's just, I just need to know how to communicate with the nervous system to understand these indicators. All right? Push. 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 Okay. So what I have discovered now is that around her shoulder, the superior part is okay, the lateral part is okay, the posterior part is okay, but here on the anterior part, we have a protective mechanism. That is the first step. So now, out of my experience, if you will, I know that if I tap here and clap, that often lets this mechanism go, but I can double check. Push.
I'm sorry.
Push. Yeah, so it did. So now let's clear the energy line again and let's see what happens if you lift the arm now.
Yeah. Okay, I couldn't do this last night.
Beautiful.
I was trying to do my little exercises.
Yeah. So I'm going to continue because there's a bunch of hidden little things in her body that need to be reset. Push. 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 Okay, so this is the middle of the back. Push. Push. Alright. Take care of that because she consists of more than just her shoulder, of course. Push. 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 Okay. Now look at your navel for me. And while you do that, I'll clap a little bit. And now you look at the camera. Okay. Push. Push. Okay. Alright, so can you also check in with your back now? Maybe do something, tell me if there's already a shift there as well.
Like it's just been burning since I've been sitting here.
That's still burning.
I feel like burning over here.
Okay.
My right side does feel a little better though, but my left side is still hurting.
Okay. So see, we're getting this real-time feedback. The left side of your back is still burning, and I'm going to see what causes that. So often in women who carry emotions, it goes into the intestines. So I'm going to check that. Push. Push. That doesn't seem to be the problem today, so check other things. Push. 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 All right. Push. 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 All right. So we're addressing the right hip, and very often there's a relationship diagonally in the body. If the right hip is weak, then the left shoulder hurts. If the left shoulder hurts, the left side of the back hurts. So let's see, check in with your back right now. Tell me if something shifted. It's okay if it didn't, but
No.
there is a shift.
There is.
Okay.
I don't understand this, but I'm into it.
All right. Push. You got a lot of explaining today. Push. Typically, I don't explain this much. Push. Push. Assess, check in with your body.
I do feel better.
You feel better?
I do feel better.
As good as you can be, or how are we?
This has gone away.
Mhm.
Like this, like you know, you get so tight, like around this like cervical area, and it'll start burning. That's not burning. My shoulder doesn't feel hot here. My lower back, I feel like I can almost feel discomfort on my left side, but it's not burning.
Will you stand up and tell me how that feels for you?
Sorry, I'm just trying to.
Yeah, no, it's important to assess everything.
Much better.
Alright.
Yeah. No.
Lift your arms. Don't think about it, just do it.
That's so dope.
Yeah.
My friends were like, "What'd he do?" I'm like, "I don't know, dude. He like was tapping." They're like, "What?" I don't know. Just get one done.
Yeah.
Oh, that's cool. Okay. Hey.
Whoa, there was a release.
Yeah. Okay.
Okay.
Yeah.
You feel like you are at the place where you know you are whenever we were done the last 2 times, and it lets you feel better.
It does feel better the next morning.
Okay.
Yeah. Like I am feeling much better already, but
Okay.
I know tomorrow.
Yeah.
When I wake up, it'll be
Yeah.
better.
Yeah, so every person has like their indicator part, and for you it's definitely your left shoulder that lets me know if you can do that effortlessly, then you will feel better tomorrow morning. So I'm just gonna do a final scan. Push. 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 Yeah, so this looks very good. Her nervous system is no longer telling me I'm in fight or flight mode. Her nervous system is telling me, based on these tests, that it knows how to relax, how to behave in a body that is at ease. And you can see, you were able to witness the immediate shift. And as she just explained to you, it takes a good night's sleep to really get you to, oh, I feel great now. And what we want for you this time is 3 weeks or longer. Okay. And then, of course, as soon as I have this video series ready that is self-serve and self-paced, you're gonna be one of the first people to have access to that, because you helped me with this video.
Yay.
And then there's, again, I want for everyone to have a pain-free life.
I never thought that would even be possible. Like, even with pain meds, I've been on pregabalin forever.
Have you been reducing the pain med?
I don't have the ability to taper down off of them, but I have been like able to skip full doses. I have been able to skip full doses. Like, that's a lot.
Yeah, that's huge. And by the way, I have to make the disclaimer that you cannot, based on what you saw here, decide to change your medication intake. You have to discuss that with your physician.
Which I have.
You have?
Yeah.
That
You can
is
send messages
awesome.
on my chart app.
What did he say about this? Or she?
She said, as long as I'm not in extreme discomfort, I'm able to not take these, because nothing else, it doesn't affect anything else, like my mental health or anything like that. So.
Was she surprised about your results? Did you tell her?
I didn't say anything other than just, if I'm not feeling in, if I'm not feeling in discomfort, do I have to take my pregabalin, which is Lyrica for those who have had fibro.
Okay.
Yeah.
Again, I see a future for you that is pain-free, medication-free, but you have to be willing to go that journey. For some people who sit in this chair, it's a one-time deal. For Monique, it's the third time so far. And it's okay. It's a very complex and advanced situation we're dealing with, but there's hope.
And it just proves you can, after living my entire life with pain every single day, every day, that you can have. Like, this is an option. Like,
yeah.
It's amazing.
And understanding what gives you the setbacks. I'm curious, what are your strategies to minimize those?
My life is pretty stress-free right now. Like, compared to what mental health plays a huge role in that. So when I have had some disruption, it did bring that pain back.
In other words, minimize the disruptions.
No kidding. Yeah, I will definitely be focusing on that.
Yeah. And we have to, that is something we owe ourselves. And again, I understand we cannot be put into bubble wrap, but it's okay to set boundaries. It's okay to say, not today. It's okay to say, I'm willing to have the conversations, but here are the rules, here are the parameters. Just because this is what that does to me, and anyone who cares about you and loves you should respect that and not want you to have a setback, because for you it results in pain, probably difficult sleep and fatigue and all of that.
That's absolutely a thing. Like, not being, my mom used to call me the princess and the pea when I was little, because it's true, I can't find a comfortable spot, and it's not my bed. Like, my bed's awesome. It is what it is. It's me.
Okay.
I'm excited about sleeping well.
Yeah, thank you for being open and willing and transparent and vulnerable to record this for everyone really who deals with this.
Hope it helps.
I'm sure it will.